Hi, everyone. I'm Matt Davids from Dana-Farber Cancer Institute. Very happy today to be joined by my dear friend, Jeff Sharman. So, Jeff, I'll allow you to introduce yourself.
Thanks, Matt. It's always great to work with you on just about anything because you're smart, and I feel smarter for being in your presence. My name is Jeff Sharman. I'm the hematologist oncologist at the Willamette Valley Cancer Center in Eugene, Oregon, and I serve as the medical director of hematology research for U.S. Oncology.
Great. Thanks so much, Jeff. Well, I know you wear a lot of hats. You're a talented guy, and you do a lot of great work with clinical trials in addition to all the patient care. But you've also been involved with some other studies, including the one we're going to talk about today, which are a little bit different, kind of providing a different perspective on things. Because, as you know, there's been a lot of changes in CLL over the past few years, and it is hard for folks to keep up. And so I think one of the key things is figuring out what are the gaps here in knowledge, and so you've been very involved with this. So I'd love it if you could kind of summarize what you found in your abstract that was titled Determining Clinical Practice Gaps for Healthcare Providers in Treating CLL Using CME-Based Surveys.
You bet. Well, thank you, Matt. It's fun to talk about these things. So we worked with an organization called Clinical Care Options, and CCO for short is an educational platform that helps really educate in multiple disease states, of which CLL is one of them. And over the course of the year, we release lectures, slide decks, and so forth to just sort of help digest the noise. Right? There's so much going on in CLL, and I think it is hard for practicing clinicians to stay on top of everything. I am a practicing clinician. I know the struggles myself, and so ideally, by kind of offering these bite-size windows, the things that distill a lot of information into short pieces. One of those programs that we've done is this survey tool. And what we did was we created a sort of an algorithm of potential clinical scenarios. And at the end of it had a handful of sort of CLL specialists identify what their preferred regimen might be under a set of circumstances. And so it allows the practicing clinicians or nurse practitioner or whatever team member to sort of go in and plug in the patient's characteristics that we think are important, such as IGHV mutational status, their FISH panel, maybe some of their disease characteristics, tumor bulk or renal dysfunction or so forth, and then come up with a treatment recommendation. Now, obviously, this is in the abstract, and so you can't take these as absolute mandates, but they kind of say how we would think about such a case. And then what we can do on that is we can develop metrics around, hey, how comfortable is a healthcare provider with their recommendation? How often does it align with expert recommendation, and so forth? So that's kind of the model of what we were doing.
Really interesting work, Jeff. I think these are really helpful perspectives, I think, to have for all physicians involved in this area and understanding sort of how to optimize therapy for patients. So, speaking of patients, what are sort of the key takeaways from this study for CLL patients?
I think there's a handful. The first one that I would highlight is that about 40% of healthcare providers reported high confidence in their ability to plan optimal treatment strategy, which means the majority aren't comfortable. And I think how you could look at that a number of different ways. If you're a patient, it's hard to know and hard to assess your own provider's level of confidence with the individual recommendation. And I think it's fair to say that there remains a great deal of sort of room for improvement in terms of how comfortable people are. Now, sometimes people can be really comfortable with wrong recommendations, which is another problem. But I think it's fair to say that a lot of people have some insecurities about picking therapies. I think that one of the things we learn is as you start diving down into the molecular subgroups, CLL is not a uniform disease, and I think that docs kind of get comfortable with one or two regimens, but then navigating under certain molecular characteristics is a challenge. And I think what we've seen over time is there's a growing familiarity and comfort with the obinutuzumab venetoclax regimen, which I think early on presented a lot more logistical challenges, but what we've seen doing this longitudinally is that clinicians are getting more comfortable doing it. And I think those are the key findings of this. And for patients who might be looking at this interview, this is the sort of tool where they can actually even go in and type in their own characteristics and sort of see where where some of the experts land and compare and contrast that with what they're getting. And again, just another way for both patients and providers to try to optimize care.
Really helpful perspectives, Jeff. So really great work. Any final thoughts for the audience?
Boy, I'm just, it's hard to really totally put into context how much this disease has changed in the last decade. And I maintain a high level of optimism that we're going to continue making progress and answering questions. The battle's not done. We still have a lot of progress to make, but I was just starting a patient on therapy today and reflecting. I don't remember the last time I gave chemotherapy for this disease. I can't remember when that was. And to know that these agents work better, I think is room for patients to feel like there's plenty of reason to be encouraged by where we're going.
I fully agree, Jeff. I share your optimism, and it's certainly an exciting time in CLL now, and we'll continue to think forward. So thank you so much. Thank you for sharing this helpful information for patients, and have a great day, everyone.
All right. See you soon.
Bye-bye.
Bye-bye.